everyone, my name is Marnie. For my pathophysiology paper, I researched cerebral palsy or CP. Cerebral palsy is a group of permanent movement and posture disorders caused by non-progressive injury to the developing brain, typically occurring before, during, or shortly after birth. The term cerebral refers to the brain, and palsy refers to impaired muscle control. Although the brain injury itself is non-progressive, meaning it does not worsen over time, the musculoskeletal complications can evolve as children grow. Pathophysiology CP results from damage to the areas of the brain responsible for motor control, such as the motor cortex, basal ganglia, cerebellum, or paraventricle white matter. A common cause is hypoxic ischemia injury, where the brain experiences reduced oxygen and blood flow. Other causes include prematurity, intraventricular hemorrhage, maternal infections, or traumatic brain injury in infancy. Because motor pathways like the cortical spinal tract are affected, communication between the brain and muscles is disrupted. This leads to abnormal muscle tone, impaired coordination, and difficulty with voluntary movement. Spastic CP is most frequently associated with upper motor neuron damage, resulting in exaggerated reflexes and muscle tightness. In addition to motor impairments, individuals with CP may experience seizures, intellectual disabilities, feeding difficulties, speech impairment, scoliosis, hip dysplasia, and joint contractures. I work at Shriners Children's, in surgery, surgical intervention plays a significant role in managing complications of CP. Orthopedic surgeries are often performed to address muscle contractures, tendon shortening, hip subluxation or dislocation, and spinal deformities like scoliosis. Procedures such as tendon lengthening, osteotomies, and spinal fusions can improve alignment, mobility, and overall function. There's no cure for cerebral palsy. Treatment focuses on improving function, preventing complications, and enhancing quality of life through a multidisciplinary approach that includes therapy, medications, assistive devices, and surgical management when appropriate. The most powerful thing I've learned while studying this condition and working with these patients is the incredible resilience of the individuals with CP and their families. Despite physical challenges, repeated therapies, and sometimes multiple surgeries, these patients demonstrate strength, determination, and adaptability every day. Their perseverance is a reminder that while cerebral palsy affects movement, it does not define potential, capability, or worth. Supporting these patients requires not only clinical knowledge, but compassion and advocacy. Thank you.